So I'll be honest, I don't care about phosphate. And I was doing some reading after some of the comments in my recent video, and maybe I should care a little bit more. Does your average non-sick, not going to be admitted patient who's going to get supportive care and go home get a phosphate level? Probably not. But there are a couple categories of people who might benefit from it. One of it is people with chronic kidney disease. But this is more of an outpatient thing, right? Because if they have very abnormal phosphate levels, it could alter the way that they remineralize bone. That's a hard word for Elmo. And it can alter where calcium goes in the body, like your blood vessels and the coronary artery disease risk. I get that. I buy that. But I think the most common one for me is people who are on supplemental nutrition, people who are dependent on G2 feeds or TPN. I think TPN in general, you are so concerned about fungemia or bacteremia, but electrolyte disturbances can be pretty common as well. So I'll usually order a FOS on those people. But the average like trach peg dependent person on tube feeds, I don't think I order a ton of FOSs for them. I don't know if I'm going to every time, but I think I'll at least think about it a little bit more. And the last is the more ICU patient, right? And it's like, if I'm putting in a central line A line and intubating somebody because they're critically ill, do they need ATP? Is there phosphate? Approximately 3 of them in ATP, and they need that to live? Sure. Is that more of an ICU problem to order a phosphate level? Sure, right? Like in the grand prioritizing of things, if I'm between like intubating, chest tube, central line, A line, whatever, like I don't think a phos level is really going to come up, but it might come up in rounds the next day for the people who I admit them to. So it's just some things I'm thinking about. There are a lot of dietitians and nutritionist type of people who commented on that video, and that was helpful for me. So thank you for those comments.